Okay, welcome to this podcast episode. Welcome to our video if you're watching on YouTube. We are going to dive into posture and gait today, and it's a just a duo, me and Sarita today. Rowan wasn't feeling very well, so we're going to catch her another time and hope she feels better. So, this is a subtle something that Sarita has done over the years of watching posture and gait of clients when they're walking in, when they're sitting conversing. And we got a small glimpse of this when we were in person with you for our foundational concepts intensive. But I want to
Mhm.
get to know a little more about it and this as a specific topic because we had talked about it in person, but it was a little bit here and there and it was just kind of sprinkled in.
Right.
So give me a definition, your definition on posture and gait in this context.
Okay. So you're right. I watch people all the time, and that's always been one of my habits. Becoming an osteopath really then accentuated that and began to help me understand the mechanics of our spine and how our bones are moved by our muscles, right? And that really we are in optimal health when things are lined up in a way that they are symmetrical so that you move your legs in the same pattern, you move your arms in the same pattern. I watch how people move, how they sit, how they use their muscles to move their bones. And so that's gait, that's how your arms swing, whether you're symmetrical or not. For posture, it really is then about how you carry yourself, even when you're not moving, and whether or not things are lined up to be able to do the best job to resist gravity. The whole point of how our spines are made with all the different, with the curves, your neck and your upper back and your lower back and your sacrum are to act as a spring so that as we walk on the earth, right, we are able to withstand the pressure of that gravity and of that bounce. That's also the job of all of the discs in between our bones. There are little shock absorbers. So that's why over time they wear out, right? Because especially if we don't let that spring be in an optimal position. The weakest places in that spring and the places people have the most trouble are right where the curve will change and go to the other direction. That makes sense, right? Just
Mhm.
in general mechanics,
Yeah.
when something changes direction, that's going to be the spot that has the most pressure on it, the most vulnerability.
Mhm.
So with postures, how you hold yourself, how you carry yourself, and we know that for that spring to really be optimal, we need our core muscles engaged. And when our core muscles are engaged, this top part of your breastbone, of your sternum, will be pointing up and out rather than
Mhm.
slouched down and forward, which is one of the things we all tend to do in how we
And we're
sit.
not talking about standing stick straight, sitting stick straight, like we'll hear a lot of times have
Right,
good posture, shoulders back.
right,
We're
right,
not
which
talking
is
about that.
important. Right. But if you think about it, when you pull your shoulders back, what happens? This part of your breastbone begins to point up and out rather
Hmm.
than forward. So,
Right.
for example, I started seeing in my family practice role, I really started seeing females in particular lose a lot of their core muscle strength in their teenage years when they began to develop breasts. Right. And so,
Mm.
there was a lot of slouching forward to be able to hide those
Sure.
curves. And then eventually also just the very weight of the breast tissue can tend to pull us forward, right?
Uh-huh.
And then we start to nurse our babies with our shoulders pulled forward and our heads pulled down.
Whew,
And
yeah.
so, there really are some patterns through reproduction for our bodies to get into a variety of those kinds of strain patterns. So when
Yeah.
I'm looking at somebody walk, I'm noticing all these things, right? Like, are their shoulders the same level? Do their arms swing about the same amount forward and back?
Mm.
Are their legs, are their feet pointing in the same direction, basically, or an equal amount out and equal amount in, so that really good health in all of our systems can be defined by how symmetrical it is. and both sides working together and bearing the weight, the pressure of gravity in an equal way, right?
So how would you say, um, because I don't hear a lot of this in mainstream midwifery. This is not something that's focused on of how we sit, stand, and function throughout our days. How do you stand at the sink and wash dishes? How do you bend over and get clothes out of the dryer? This is
Right.
not something that's focused on. I focus on it and I have a lot of resources that I give out to my families. But because I know the importance, but I'm also saying that this is being skimmed over. So tell us about why. Why do we want to focus on this? Why do we want to educate on this? How does it affect pregnancy and birth?
Right. Well, there's a lot of different ways we can think about this. The first thing we can think about is the added weight and the added pressure of pregnancy is going to make any of the weaknesses we already have worse if we don't correct for it, right?
Mm.
Even if we don't have any of those, and most of us do from, injuries or positions, things we've done. Even if we don't have any major problems over time, one of the things that will happen in pregnancy, for example, the weight of our uterus will tend to make the curve in our lower back accentuate and become more curved, right?
Mm.
Right. So, which is going to make it more fragile, more vulnerable to any kind of injury or to that wear and tear that I was talking about. So some of it of how, and as a 69-year-old person who has worked very hard physically and had several babies, what I can tell you is that you always pay for all the fun you have sooner or later, right? That's what I always say. So a lot of the things that I deal with now, I can trace back to how I may have overused my body or how I may have
Mm.
overlifted at various times, sometimes because of lifestyle, sometimes because of stubbornness, carry all the bags from the car kind of thing. So it really is that we also live in a culture that pushes us to do more all the time and defines us by our workload. So there's many things wrapped up in why we sometimes don't listen to our bodies and we don't get, use it properly because we're in a hurry. So you'll begin to see sciatica, right, in
Mm.
pregnancy. That's one that it comes totally from not using our bodies in the way that they're optimal to hold themselves. You see a lot of rib pain. You see a lot of, upper shoulder pain. All of those things in pregnancy that then can limit our movement. And we know that being able to move and be supple and be strong and feel good in our bodies is important to our mindset. So it's connected to everything.
Would
And
you
then once we,
say suprapubic pain as well?
yeah, super pubic. Part of that's because we know that, so I'll show you an osteopathic thing, right? Like we know that that cartilage there in between the pubic bone, because the pelvis is not a solid bony ring. We know that, right? And it has all these various joints. I was just showing this to somebody the other day. If it were a solid bony ring, when we walked, we'd have to swing our legs around, right?
Uh-huh.
So the pelvis actually moves like
Right.
this when we walk. And if we step in a hole, maybe that's exaggerated, but like we could step in a hole
Hmm.
and then that makes this not be able to move right. Or, something that throws it off such that now this side's really moving far and this side's not moving as far. And that's what I'm talking about with the symmetry. So the
Okay.
first thing
Right.
I do when I watch somebody walk, whether it's an airport, a beach, when I was in practice, I'm watching first to see how they carry themselves. Head up, shoulders
Hmm.
back. That tells you a lot about a lot of different things, as well as the symmetry of how they walk and move. Okay. There's, and I know stories, Rowan has one, and I've heard many others where discovering a big asymmetry wasn't discovered until labor, and then it had a definite effect on the ability of the baby to get out and the decisions that were made. And realizing that if we put our hands on people and looked for that symmetry during like an initial exam, we might be able to make changes during a prenatal course that would then affect the birth being easier to navigate. So
Mhm.
that's another big reason for it if something's out of whack, right? If you can get it balanced before labor starts, then you should be able to have an easier, lack of a better way to use that word, easier time, more straightforward process.
And
Yeah,
so this is a get to the root of it versus let's kind of damage control with different movements and
right.
positions in labor, which we see a lot of.
Right, right, right. Like let's get to where and chiropractic, osteopathic manipulation, there are lots of ways.
Mhm.
Physical therapy, there's lots of ways to be able to correct something. And sometimes it's just your awareness of how you use your body. I know it is for me. And sometimes, what we tend to do is think that something that hurts because we're too busy, we just want to cover it up, make it go away, instead of really listen to it and tell us what it is that we're maybe not moving quite as smoothly or symmetrically as we need to,
Yeah.
right?
In my pregnancy, I had really, really bad sciatica
Mm-hmm.
and really, really bad pubic bone pain.
Mm-hmm.
And I was seeing a chiropractor for the majority of my pregnancy 2 times a week, or no, 2 times a month.
Mm-hmm.
And but it never, and see now I know what I know. But in the moment it never fixed it. And so I thought, man, I just have to keep going back. She has to keep
Mm-hmm.
realigning me, but I was never steered, and I don't blame this on the chiropractor.
First,
But I was never steered in the what's how you're using your body. It's your
right,
function is off.
right,
It's not that I need to keep realigning you, it's that you're just not in alignment with what your body needs. And
right.
so that was a big eye opener. So next pregnancy, I've got definitely some different plans on, and already I have implemented how I use my body differently and how
Mm-hmm.
in my day-to-day tasks how I function.
Mm-hmm. Exactly. You learn to listen because if not,
Mhm.
your body, yells louder and louder.
Yeah.
You're absolutely right. And I've seen, there's one approach to just keep going back and getting fixed and hoping that eventually you don't have to do that anymore.
Yeah.
My approach to a lot of this of my practice has always been to put myself out of a job, right? Like if I do my job well enough, you
Hmm.
shouldn't have to come back. And that
Right.
was really very much my intention. And while I'm more than happy to work on people, I was, I still will, um, friends and family, then um, but I always started with, well, what is it you're doing in your everyday life to create this? Because our bodies are always answering to
Yeah.
what we are asking them to do, right? And I'll just have to tell you, in med school, some of the things we saw whenever we would look at the bones of people and be able to guess or come close to guessing what kind of occupation they were in based upon how their bones had changed to
Fascinating.
handle that type of movement, right? So our bones and our bodies are constantly reacting to what we're asking them,
Hmm.
right? And they talk back to us and tell us, maybe we could calm it down a little bit, or maybe we could adjust how we do that,
Right.
right? Yeah. So,
So currently,
mhm.
I have the most back pain, and don't diagnose me, Dr. Sarita. That is not what I'm asking. But currently, I have the most lower back pain when I'm standing washing dishes.
Mhm.
And I can recognize in my body that's because I'm jutting my pelvis forward.
Yes.
I'm not quite sure why. Like why that makes me feel like I can do dishes better. I don't know. But even then, if I were to try to be mindful and keep awareness around keep your butt behind you, it still doesn't make it more comfortable. So do you have thoughts or tips around standing cooking dinner, standing washing dishes?
Yeah, yeah, I know. It's really, for me, a lot of times it's my calf muscles because
Mm,
I have a tile floor and I go barefoot, right? So standing in that one position, again, your body does what you're asking it to do. When
yeah.
you're standing still in one position, it's going to do its best to try to, like keep you there.
Yeah.
And your body's not really happy with that because again, it's having to withstand the pressure of gravity and it's not an easy job. One thing that always helps really is to have some kind of padding under your feet. like those foam pads that go in front of stoves or sinks, just because again, it's helping you withstand that pressure of gravity. If you're thinking about what are my bones trying to do? They're trying to
Mhm.
hold me up against the pressure of gravity, and then they're trying to help me move through that same atmosphere, right? So good padding and that kind of thing. The other thing really I found is to not stay with your legs locked in one position, being able to rock back and forth. That seems to help, and to take breaks. Like you don't have to do it all at the same time. How can we, what can we do to be easier on ourselves? Like that's part of what I'm learning to do as I get older is how to not expect so much of myself all the time, how to take breaks, how to stretch in between all that, how to, you know, just how to use my body better. The other thing that I learned, and I'm very grateful a long time ago, and I like before elementary school, this this retired ballet teacher moved into our little country community, which is amazing that any of us, country kids took ballet. And she was not, she was a taskmaster, shall we say. And I just remember, and I think this is not a bad idea. And my mother had me do this too, walking around with a book on my head,
Mhm.
right? And you couldn't let the book fall off.
Uh,
What I later learned to do that, think of that, is to think of yourself like a puppet and somebody's pulling you up by that very top of your head.
mm,
And what you'll find is that as that happens, things go into better alignment. Now, the problem with better alignment is if we've been sitting around in poor alignment and now we ask our muscles to do something different, it's not going to feel good, especially at first.
right.
So, right, because your body's like, what? But I've been doing this other thing, and now you want me to do
Right.
something different. So it's not something that you just can suddenly go, okay, I'm going to make this a new pattern and have it just fall into place. So
Mhm.
that's the other thing to always remember when you're changing something, like maybe you've got one leg shorter than the other. And this is a very common thing. People don't know that. And it's not just in West Virginia, right? Like a lot of us, and I actually think a lot of these strain patterns start while we're in utero,
Mm.
based on the way like we were laying in our mother's uterus. Maybe our left side was a little more prominent, or these patterns start then again, because our body does what we ask it to, right? So a lot of us are born, and it's true for me, where one leg is a little shorter than the other. And the problem becomes that you'll begin to get a curve in your spine the wrong way. That's called scoliosis, right? It's okay to have the curve front to back, but it's not supposed to
Mhm.
be side to side. That's
Mhm.
scoliosis. And it does that because the whole job is to keep like if your one leg was shorter, right? Then your head would be
Right.
crooked. Your eyes wouldn't be level. So the whole job of the spine is to keep your eyes level and withstand the pressure of gravity. Does that
Right.
make sense?
That's
So a lot of it, really, I just tell people, let that string pull you up, pull your shoulders back, lead with your nipples, and have the sternum, pointing up and out. Try to and just do what you can. A lot of times I sit on stools or I sit on things so that I can't slump so much, so that I
Mhm.
have to make my or exercise balls. They make you sit in a different way.
Right.
The thing with sciatica, I'm not going to diagnose you, but the thing in our day-to-day lives that we do that makes that worse, is especially when you get really big and pregnant, is one, you sit with your knees far apart,
Mm.
and that activates the muscles that the sciatic nerve comes up through. The other thing is you stick your hip out, you put a kid on it, right, or a
Uh-huh.
laundry basket. That also then makes the sacrum have more pressure where the sciatic nerve comes out. And then the third thing is we stand with a foot turned out. So when we turn our
Mm.
knees or our feet out, it activates the muscles in our buttocks that squeeze the sciatic nerve. And if those muscles are staying tight, then that nerve is going to get pinched and you're going to
Mm.
feel it down your leg, right? I'm sure you understand what I'm talking
Oh
about.
yeah. Oh yeah.
Yeah, what we say is it's like stepping on a cat's tail. The noise comes out the mouth, but the problem's at the tail. right? And it's just that's just a really easy thing for pregnant and postpartum women to
Yeah,
suffer with sciatica.
totally.
Yeah,
So I'm hearing you say it's about awareness of our how our body wants to function,
right. How we
how
want to use
it's
it.
yes, and how it was built to stack.
Right.
Um, are you familiar with bowspring movements or bowspring quote unquote workouts?
Not right off the bat. I know a variety of kinds of, exercise programs, but what's that one in particular?
Bowspring is all about the curvature of the body. And
Ah,
so they are about activating and rounding out your glutes and having your
uh,
whole back chain be turned on and standing
uh,
with this spring in your knees
mm-hmm,
and having your ribs be stacked above your hips above your knees.
mm-hmm,
And I've really enjoyed
mm-hmm,
awakening certain parts of my body using those movements because
mm-hmm,
it was just so not natural to me to have my hips back.
mm-hmm,
And not necessarily in this, oh, I'm putting my butt out there in this overly exaggerated tilt, because that's where I was getting lost. I was thinking, oh, put your butt out there. Okay, I can do that. But it was way too tilted to where it was causing more problems.
right,
And
right.
so I've had to find within my own body of like, okay, how much tilt is too much? And where does that feel proper with my lower back? My lower back is mostly my issue. Um,
Usually. Mm-hmm,
so where's that perfect angle for me?
mm-hmm,
Um,
mm-hmm, right.
but
Right. And then when you find it, then that's the one that your muscles can work the best, right?
mm,
Because your muscles are what move those bones and like if your muscles are all contracted, they're going to be pulling them too close together. Like, or
hmm
one side's contracted and the other one's not, they're going to be asymmetrical. So once, part of that is helping the muscles be relaxed enough to let the bones go where they need to go and stay there. That's what makes the difference in changing your patterns in your everyday life. Like the chiropractor or osteopath can put the bones back where they go,
hmm
and you have to change your movement so those muscles can relax and let the bones stay there
right.
where they need to be. And the other thing with pregnancy, remember that your body, you're not just pregnant in your uterus, right? Like you're pregnant in your whole body. And there's so many things that change, like the softness of your cartilage, but also your rib cage moves up and out to be able to accommodate this growing
Oh yeah.
uterus and still be able to get 100% oxygen, even though your diaphragm can't, like push against it. And that you'll see it. So you'll see a lot of rib pain because of that, especially if it kind of gets stuck and doesn't come back down again,
Yeah.
especially postpartum. So, like we have this mechanics that we understand that we are all susceptible to, and then we, complicate it by putting in um, extra weight and a baby sloshing around, right? That pulls you forward and makes your ribs go up. And, like an old timer once told me that one of the ways they used to know that somebody was pregnant before the tests where they kill a rabbit, as they say, the old ones, was they knew the baseline of the measurement of your neck. And they would measure your neck and it got wider
Ooh.
whenever you got pregnant. If you think about it, that makes sense because the ribs move up and out. And that would make this,
Oh,
because your first rib is right up, your first and second ribs are up here. So that would make your ribs change position and your neck get wider at the base.
how
And that isn't that
fascinating.
fascinating, right?
Well, I've
Like
never heard that one.
your whole body gets pregnant, right?
That's cool.
Yeah, yeah. So
I super enjoyed this conversation. Is there anything else you want to add in before we're finished?
the only thing I can say to all of us is hold your head up high and hold your shoulders back and
Lead with your nipples.
lead with your nipples. That's right. And enjoy life, right?
Sweet. Okay.
Yeah.
Well, thank you so much, Sarita.
Thank you.
Talk later.